Oh, do I have to say? Okay. So I'll say it again. A warm welcome to everybody who has come to our FND Awareness Day online event that we do with FND Action, FND Dimensions, and FND Friends. And this is the 8th year now. We've been doing awareness, and it's just getting better and better each year. If you've missed this morning's session with Steph, it has been recorded, and so will this one be recorded as well. I'm very excited again to I can't remember what I said now, FND Paul, what I called you. But anyway, FND Portal is an amazing FND advocate and campaigner for patients. If you've on Twitter, sorry, X, you'll see that he does share a lot of posts about FND. So we're very excited to have him here. Thank you for coming, and I'll pass it over to you.
Thank you so much, Kim. Much appreciated. Okay, so I am on a new laptop today because of some technical issues. So I'm going to take just a minute to share my screen and set this up and just validate that everything here is working the way that it's supposed to. Okay, so let's see. I'm going to try to go into presenter view here. And okay, does that look okay? All good? Great. Okay. Yeah. Thank you so much. Okay. Hi, everybody. It's so nice to be here with you today. So lovely to see everyone in the room. I'm delighted to be here with you today. Before we get started properly, I want to begin with some quick but important thank yous. Firstly, to Steph Blanco, who was up earlier today, a wonderful researcher and person with a lived experience of FND. And sorry, really quickly, should I keep seeing when the participants are entered in the room. Is that okay? Yeah, we'll just leave it. It's fine. Okay. So anyway, yes, thank you to Steph Blanco, who was up earlier, for sharing your insights and perspective with us. I'm also really excited for the presentation by John Stone that's coming up later today. Professor Stone is one of the absolute leaders in the research and treatment of FND, so that will be well worth checking out. And of course, I want to say thank you to the folks who are putting this on today as well, to the FND groups that are making this happen today. That's FND Action, FND Dimensions, and FND Friends. Thank you all for hosting. These folks do a lot of organizational and infrastructural work to make events like this happen. They're also, in many ways, supporting people with FND in the UK year-round. And they do a lot of work behind the scenes that people don't see, and they deserve our thanks and support. So thank you once again, and let's get into it. So I'm FND Portal. I'm an anonymous person with FND, and this talk is not about me, but I figure since I'm here, I should probably introduce myself a little bit. So I've had FND since late 2010, and like many people with FND, perhaps like you, FND has radically changed my life. When I first got it in 2010, it was triggered by a vocal injury to my larynx. And so the first thing that happened was I lost my ability to speak. Over time, as often happens with FND, the symptoms spread, and I began to lose my ability to use my hands, and then eventually lost my ability to walk. So I had about a year where I was using a wheelchair. And then after that, was able to do some rehab and things that made it better. But as you can see from the bio here, I had FND in 2010 and was actually diagnosed in late 2017, almost 2018. So I went essentially 8 years undiagnosed. And during that time, I met many doctors who told me that they could not figure out what I had, and that no one would ever figure out what I had, and that basically I should just kind of go home, you know, reconcile myself to the fact that no one would ever figure this out and just deal with it. And I didn't like that very much. And so part of my journey as a person with FND has been basically picking up textbooks online and learning things like anatomy, physiology, neurology, neuroscience. And I was doing that when I was undiagnosed just to try to make sense of what I had. Now, ultimately, I was not the person that figured out the diagnosis. A team at the NIH did that and thankfully diagnosed me. But that reading that I did help me make sense of things once I got the diagnosis. And I think in a lot of ways that kind of sense making continues to be my role today. So as a patient with FND, I'm an advisor to the research and medical teams that you see here. And I also have a role going in the other direction where I spend a fair amount of time kind of synthesizing the science and the new findings that are coming out on FND and bringing that to people with FND so that we can learn what science is telling us about our condition. Most importantly, to me, I'm a member of the FND community and very happy to be here with you. And while this talk is called The Future History of FND, I think you'll also find that community is one of the really strong themes that emerges here. And specifically, we're going to be thinking about what community means and why it matters for FND, both socially, but actually also biologically, which might be a bit of a surprise. Now, in just a little bit, we are going to get into that history and try to make some sense of FND that way. But in order to set that up, let's actually start by defining what we're talking about. So what is FND? Well, it's a disorder of brain function, just like it says on the tin. You probably know, if you're in this room from your own experience, excuse me, that it can be often severely disabling. It can be very emotionally distressing, and it can be physically painful to have it, which I think is an aspect that is often overlooked when folks are talking about FND. Now, why does this happen? Well, typically there's some kind of an inciting event. There's a trigger that basically causes FND to get started. Something triggers brain networks to change their communication patterns in the brain in such a way that it produces disability, where the brain can no longer control the body the way that it once did. And one of the things that's kind of strange about this is that FND is, unlike other disorders, for example, Parkinson's or MS, where there are these kind of obvious disease processes happening in the body. In FND, it's almost more like the brain is following its normal rules of how brain cells talk to each other, but they kind of follow those rules into a bad outcome. So it's kind of like if you've ever seen a game of baseball or another sport where the players are following the rules exactly as they should be, and the natural outcome of that is that they end up playing like a ton of overtime, that doesn't normally happen. They kind of get stuck in this loop where like the game doesn't end. FND is a bit like that in the brain, where the brain cells sort of update their behavior in such a way that they get kind of stuck in a loop and can't get out of it. So in order for us to understand FND, let's talk a little bit about the brain. Let's talk a little bit more about what the brain is doing when this happens. So you may have heard the phrase, you can't see the forest for the trees. Well, in this case, we're actually going to manage to do both. We're going to start at a very zoomed in level, like a tree level view of FND. And then we're going to zoom out to look at the forest, to look at the sort of the whole brain. So at a very zoomed in view with our mental microscope, we can see that the brain is full of billions of cells called neurons. And these neurons fire electrical bursts. This is how they communicate with each other. And the electrical bursts are called action potentials, or sometimes they're called spikes. And you can see in this animation on the right here that the charge starts in the kind of main part of the cell. It travels down this long projection thingy, which is called an axon, and the electrical charge ends right here. And when the charge gets to this far end of the neuron, that causes the release of some chemicals called neurotransmitters. Now, that's kind of a sciencey term, but you've actually probably heard of some of these. Neurotransmitters are things like dopamine, serotonin, adrenaline, things like that. And when these neurotransmitters get released, they float across a gap called the synapse, and then they sort of latch onto the next neuron, which causes that neuron to activate. So you can actually see this a little bit better in the next slide here, where we have, this is the main body of the neuron. It fires this electrical signal down the branch. And when it gets to the end here, that causes these little compartments to open. They release the neurotransmitter out into the gap. The neurotransmitter latches onto the next neuron, and the next neuron fires.
Let me just...
Oh, do we have to mute some mics? Okay, awesome. So in practice, this can be a little bit more complicated than just one neuron activating another. For example, some neurons might release their neurotransmitters and activate many nearby neurons. But nevertheless, this is basically how it works. Neuron fires the electrical potential, that causes the release of the chemical, that fires the next neuron, and that's how the message is passed. Now we zoom our camera out. And as we go up a level, we can see that neurons don't act alone. They actually form into larger groups called brain areas that are visible to the eye. You've probably heard of some of these too. These are things like the hippocampus, which is where memory is formed, or the amygdala, which handles threat processing. And these brain areas in turn kind of link together to form teams called brain networks, which you can see on the right here. So here's a bunch of like individual brain areas that are talking to each other to form a network. And networks help us do some particular task, like there are movement networks, there are attention networks, stuff like that. So when FND happens, this is a change in the dialogue between these different areas in the brain. And the reason it happens is because neurons update their behavior and learn when we have new experiences. So for example, if you learn to ride a bicycle at some point in your life, your brain network activity changed as your brain got used to you doing that new activity and learning how to do the new thing. Now, over time, as you become comfortable riding a bike, those changes become more durable, right? Like it actually at a certain point becomes hard to forget how to ride a bike. Like once you've got it, you kind of got it. FND is also kind of like this, but it's a change in brain network activity that is unhelpful rather than helpful, like riding a bike. So you get sort of, something happens to you, like you get an injury or an illness or an emotional trauma, your brain networks change their activity, and now all of a sudden you're kind of stuck in this new configuration that can be difficult to get out of. One quick thing I want to highlight before we move on is that these brain networks that FND affects are what are called core brain networks. This means they're kind of like at the center of the brain's organization, and they respond to both psychological and physical stressors. So that might explain part of why people can get FND for many things, like, trauma or like injuries, is because when you're having a really difficult, overwhelming emotional experience, or when you're having a physical injury that overwhelms you physically, those signals are ending up in the same place. And the place they end up in is the networks that produce FND. So you and I know that FND can be quite seriously disabling, that it causes major problems for our lives, and in many ways can be quite devastating. You also probably know that it's often not treated that way today. You might go to the doctor and they say things like, oh, don't worry about it, it's all in your head. They may say things like, I don't see anything physical, you don't have an organic disorder. It's very strange because it's not treated seriously. And in some ways, FND is not even that widely known today. That's why we're having an awareness day, right? And this is strange because FND is actually a disorder with one of the longest histories in medicine. It actually begins with a very old medical diagnosis called hysteria. Yes, the word that you've heard used as an insult to mean you're blowing things out of proportion is the original term for FND. And that says something about how stigmatized FND has become over time, that the original name for our disorder came to mean someone making a big deal out of nothing. Excuse me. So in order for us to make sense of this, let's really quickly start at the beginning. So let's imagine for a sec that you were born in, say, the year 1500. Now, if you developed your FND symptoms at that time, people would have blamed it on witchcraft. They might have thought that you were a witch, or they might have thought that someone else bewitched you, just depending on the situation. And this is pretty grim because people were killed over this stuff. So as we start to emerge from the Middle Ages and get into what's called the early modern period, there are witch trials happening where people are being accused of witchcraft, sometimes over symptoms of FND. And what happened at this point is that some doctors at this point started showing up to these trials and saying something different. They looked at the situation and they said, you know what? I don't think this is actually witchcraft. I don't think it's demonic possession. I think this is some kind of a bodily disease. But if you're going to convince a skeptical judge who believes in witches that it's not witchcraft, you have to have an alternate explanation, right? So what these doctors did is they looked for an explanation, and they found one in some books by the ancient Greeks and Romans, who these medieval doctors went to for kind of like better knowledge. And in these ancient Greek books, they found a series of womb disorders that could cause symptoms of, seizures and stuff like that, or so they thought. And so these European doctors scoured through all the ancient Greek texts. They pulled together all these different accounts of these like womb disorders that they think they found, and they rolled it up into one giant new thing, which they called hysteria. So they said this is all one disorder and we're naming it hysteria. And the theory at the time was that in hysteria, and it was always in women, that symptoms were caused by a renegade uterus, honestly. They thought that the uterus kind of like wandered about the body and would sort of like cause damage and chaos where it went. Sometimes they thought that it was kind of like an animal that was suffocating. This obviously does not make a ton of sense, but for what it's worth, that's what they thought at the time. And at least it's not witchcraft, right? So baby steps. But the problem here is that this also carried with it a lot of sexist stereotypes of ideas that women are more emotional than men, that they're more kind of illogical, that kind of thing. And that caused a lot of problems that we are still dealing with today. So we're going to skip through about 200 years of history in like 2 to 3 minutes. So just the super high points. So we start with this kind of vague idea of hysteria, and time marches on. And in the beginning, there's great confusion. No one completely agrees on what hysteria is. No one completely agrees on what causes it, or even what symptoms fit under it. And this is a bizarre situation because hysteria at this point is almost a name in search of a disease, which is the opposite of the way that it normally works, right? Normally, the way it works is there's a disease that exists out in the world somewhere, and doctors notice it, and then they give it a name. So, for example, in Parkinson's, they'd notice that people had slowness, stiffness, shuffling of gait, tremors, stuff like that. And a doctor at one point named James Parkinson noticed all those things together and said, we're gonna name this as a disease. In hysteria, it's almost the other way around. They almost have this idea of hysteria before they have a proper disease to put it on. So over the course of the 1700s, getting into the late 1800s, eventually things improve. Basically, the diagnostic net comes to fall upon the symptoms that we now know of FND, things like functional seizures, limb weakness, tremors, stuff like that. So this name of hysteria could have kind of fallen on anything, but through this long, complicated process, it comes to name the symptoms that we now know as FND. And when that happens, neurologists step forward and they say, you know what, this uterine stuff doesn't really make a ton of sense. For these symptoms of tremors and seizures and stuff, those things are caused by the brain. The brain is the organ that has the power to do those things. And so the story of the 1700s to the 1800s, somewhat surprisingly, is that basically medicine gets better. They get seriously better at looking at this and thinking about it. And by the 1890s, FND could actually be reliably diagnosed. You had scientists like Jean-Martin Charcot here, who did a lot to advance the science of diagnosing FND. He diagnosed it in both men and women. And he even gave us a precursor to the name of FND that we have today. He talked about something called a functional lesion, which is the idea that there's this kind of roving impairment in the brain that causes, disability at different spots. But there were limits at this time. They didn't have things like MRIs that we have today. They didn't have things like modern blood tests. In terms of treatment, there wasn't really that much they could do to help. Charcot here, who was kind of the leader of his time in neurology, the best that he could do was actually hypnosis, where he would hypnotize people with FND. And under hypnosis, he could sometimes get their symptoms to release. And while this is interesting and kind of suggests some fascinating things about the brain, it also kind of made him look a bit wacky to his peers at the time. And then in 1893, Charcot dies. And all of a sudden, this sort of leader of neurology that all these other guys in this painting are looking up to is gone, and his proverbial throne is empty. And all of a sudden, there's an opening for someone else to come along and tell a new story of hysteria. And as it happens, that person is Sigmund Freud. So this is where we're going to start thinking about different accounts of FND and how people have explained it over time. Now, Sigmund Freud, in 1895, that's just 2 years after Charcot dies, he publishes a book called Studies on Hysteria. And this has a radically different interpretation of what FND is and why it happens. And today we call this the conversion model. So this is Freud's conversion explanation. Freud said that FND is caused by a repression of memory. Freud believed that almost everybody with FND had seriously traumatic experiences in childhood, often sexual abuse. And what he said is happening in FND is that people with FND have these experiences. We don't want to deal with it. It's too traumatic. It's too much to deal with. And so, according to Freud, what people with FND do is repress the memory, like intentionally try to forget it and sort of bury it in the subconscious. But instead of that memory going away and just staying gone, it sort of leaks out like toxic sludge in the ground, and it pops out in the form of a physical disability. And so what Freud would say is that what you need to do is work with a psychoanalyst to remember the traumatic things that happened to you, to deal with them productively. And then when you do that, the symptoms will resolve. Now, I want to own my own bias here. I'm not exactly a fan of Sigmund Freud. I do want to try to be at least fair and give him some credit. I think that he had a good point in terms of emphasizing childhood adversity. A lot of people with FND have been through stuff at some point in their life, and that leads to very bad health outcomes in FND as it does in other disorders too. And he also highlighted the role of the unconscious. We know that a lot that the brain does is outside our conscious awareness. That's a fair point. But Freud's whole worldview here, I think, has some significant problems as well. The first is, how do you know if he's telling the truth? If you go to a psychoanalyst and you say, I don't have any trauma, and they can easily just say, yes, you do. And the reason you think you don't have any trauma is because you're repressing it. And so then the psychoanalyst gets to kind of impose their narrative on you about your life and why things are the way they are. The other major thing I have to sort of raise against Freud is the question of how representative is his view. So there are some people with FND whose stories appear to sort of closely mirror the conversion idea, that it does kind of look like that. And I want to say, if that's you and you're on this call and you're thinking that Freud's account makes sense, that's okay. Like if that's a suitable explanation for your situation, that's totally okay. My objection here is not about that. My objection is about, does Freud's theory explain people with FND as a group? And I would argue that it does not, because there's a lot of people with FND who got it through physical injuries that were not necessarily they don't have major life trauma otherwise. There are people with FND who did go through emotionally traumatic events, but remember them quite well. So I just think there's a lot here that just doesn't really match his story. And what happens is something curious, which is that Freud becomes very popular. Sorry, could we mute the mic? Thank you. And when Freud becomes popular, this is the view that comes to dominate FND, where everybody, when they think of FND, they think of Freud and this explanation. But then in the late part of the 20th century, Freud falls from popularity. Things like CBT kind of, supersede psychoanalysis. And as Freud goes down in popularity, they kind of throw out the whole concept of FND with him. So they kind of throw out the baby with the bathwater on this one. But of course, Freud's way to think about FND is not the only way there is. At the same time that he was working, there was another guy, and this is him. His name is Pier Jan. He's a French psychologist. And Janet's work is actually really foundational to the study of dissociative disorders, including things like PTSD. Now, what's curious about Janet is that his work on these other conditions is still widely recognized. You can go open a college textbook, read about PTSD, and see references to Janet there. But he did work on FND that was equally important, that has been almost entirely forgotten. Now, Janet's explanation of FND was that it was a dissociative disorder. He describes it as a retraction of the field of consciousness, which, what an image. What Janet means here is that think about all the different things that your brain enables you to do, right? So you can feel your skin, you can move your body. If you're, able-bodied, you can see things, hear things, taste things, smell things. You can think, you can remember, you can imagine, you can plan. And so your brain has this ability to do all these different things. And it has to bring all that together somehow and integrate it into oneself to make you you with all the things that you can do and have access to. And what Genet said, by studying people with FND, he said that people with FND have trouble integrating these different brain capacities. That, for example, they may be able to move 3 limbs, but they have 1 limb where like the conscious kind of part of their brain can't access that and command it properly. Or you have cases like functional seizures where the brain seems to kind of disconnect from the body entirely and like not recognize that it's there. So this is a different kind of way to think about how FND works. And here's an illustration of that. So this is from a lecture that Genet gave in the early 1900s. We have these T's here with the different marks next to them. This means like different aspects of touch. We have the M's, which are like your ability to control different muscle groups. V for different aspects of vision. A for auditory or hearing stuff. And then here we have this circle, which says personal perception, which basically means consciousness. And so the idea is that the brain has to somehow bring all these different things together and bring them into your conscious command for you to be able to like use this stuff. Now, this is a metaphorical drawing. Genet didn't necessarily think there was like a literal circle in the brain where this consciousness exists. He was just saying there's different systems in the brain that handle different things, and they have to be brought together somehow. Fortunately, today our maps have improved somewhat. This is a modern diagram of what we think the affected systems in FND are. And it gives you an idea of the kind of thing that we're looking at, where you have basically overconnections and underconnections between different parts of the brain that produce FND symptoms and make it hard for us to control our bodies. So that brings us to today. I'm actually going to keep this part quite short because you likely know well the kind of challenges that we have today. People with FND are underdiagnosed, undertreated, stigmatized, disrespected. So let's spend our time instead talking about why this is. And to me, a lot of this comes back to how the medical profession itself thinks about disease and FND. So when I look at how doctors behave and just try to figure out their worldview from that, what I see is that they have kind of 2 ideas about what disease basically is. They see disease as basically a structural problem that breaks down into stuff that shouldn't be there, like a bacteria or a virus, or broken parts, like in MS, when your immune system attacks your spinal cord and the spinal cord gets damaged. That's an example of broken parts, or like a broken leg would be an example of a broken part. So doctors do tests that look for stuff that shouldn't be there and that look for broken parts. And if they don't find anything, they say, you don't have a structural problem. They may say it's not physical. And that sort of implies that whatever problem you have is not real. I'm going to be honest, this doesn't make any sense to me because it kind of implies a belief that the body works by magic. Like the idea that a doctor does an MRI and okay, they scan the brain and the brain's still there. And because it's present and apparently, the structure is there, that it's just going to keep working and doing all its functions and actions perfectly forever for no reason, just doesn't make any sense to me. Nothing in biology works that way. Things always happen. So anyway, this whole thing of looking at disease as a structure problem, I think is a lot of why we are where we are right now. And that goes with the second part, which is that there's still a lot of stigma against mental illness in society, but also in the medical system as well. My personal view here is I don't really consider FND to be a mental illness. I think if you have to choose, it's kind of like a third thing. If you have like traditional neurological disorders like Parkinson's, you have traditional mental illnesses like, say, depression and schizophrenia. I think FND kind of makes a third category and that they can influence each other and make it more likely that you'll get one or the other. But in any case, no matter what I think about it personally, the fact is there's still a lot of stigma against mental illness. And many doctors treat mental illnesses as being less serious, less worthy of care than physical ones are, as if schizophrenia can't kill you. So we end up in a vicious cycle where, because this is not taken seriously, doctors don't get trained on it in medical school. that means they don't know how to diagnose it. And that means they don't diagnose it. And so there are fewer, it looks like there's fewer people with FND than there really are, which gives us a lack of representation and then a lack of social respect. And so you get this kind of cycle that goes around like that. Now, you may have noticed something missing from the presentation up to this point, which is namely any perspective from people with FND throughout history. And there's a reason for that. It's really actually not that easy to find people with FND talking on the record throughout history about their condition, mostly because we were not allowed to. Or if we did say things, they would say, oh, you're just hysterical. And they would sort of look at it like that. And so when I look at today and what's different about now, yes, the science is coming along and that's great and important. But actually, I would say the most important thing is that we are here and that we have the ability to make a difference. So what can we do with our ability to create change? I think of this at sort of two levels of scale. I think that we can take action to create a better dynamic in two communities at once. In the little community of our brain, in the way that these different brain areas talk to each other. So we can do things like physiotherapy and psychotherapy. We can choose where we put our attention. We can plan out how we use our energy over the course of the day. And all these things create a healthier kind of dialogue and balance between the different areas of the brain that help us get better and help us manage our symptoms better when we have them. We can also sort of contribute to healthier dialogue in society. You know, there has been so much bad that has happened with FND up to this point. The fact that we can show up and advocate for better care, advocate for legislation for people with FND, the fact that we can just show up and tell our own stories, you know, not even advocating for something in particular, but just saying, this happened to me. Here's what happened to my life, and this matters, and it's worth hearing about. Those things are really powerful. So I think this is actually a really exciting opportunity to be where we are in time right now, because if we can make the world a more safe and welcoming and just place for people with FND in our time, then these things that have happened in the past need not be pointless tragedy. We can't fix what happened to people with FND earlier in history, right? But we can add a new chapter, which might kind of reframe how things happened earlier. So we can add a new chapter in which we start to reverse the medical sexism, in which we fight the stigma against mental illness, in which we begin to explore the connections between brain and mind and body. And if we can do that, then something positive will have ultimately come out of the tragedy that happened before us. And I think that's worth it. And so what then of the future of FND from the scientific perspective? Well, I think we're all pretty much on the same page about what needs to happen, you know, in the near term. Everybody wants more treatment, better treatment, treatment accessible where you live instead of just being in major cities. You know, as tough as it can be to live with FND in the UK, in that healthcare system, I have to tell you, unfortunately, it's actually much worse many other places, even in the US and Canada. So just getting treatment, proper treatment rolled out in many places around the world would be a huge win. And I think that's well worth fighting for. But let's also think a little bit further ahead too, because we have an opportunity to be here together today. And I want to tell you a little bit about the kind of dream that I see. So I would love for medicine to be able to shift away from this structure-only model and start looking at how the body functions at multiple levels of scale. So you remember the forest and the tree that we saw with the brain earlier, you know, where you're zoomed in at the cellular level, and then you're zoomed out to the level of networks and the whole brain. I think there's a lot we can do to sort of promote health at all these different levels of resolution. And fortunately, we actually already have a good foundation for this, which is called the biopsychosocial model. You can see it here on the right. We're just going to touch on this really quickly. On the biological part, you have things like your physical health, your genetic vulnerabilities, reactions to drug effects, including drug withdrawals. We have on the social side, things like peers and family relationships. I would put work there too. On the psychological side, we have things like coping skills. We have strategies and self-esteem. You know, when something bad happens to you, how do you navigate that? And how do you sort of support your own resilience to deal with adversity? And so that provides a solid foundation. But I want to take actually just a second here at the very end of the talk to kind of blast off into hyperspace with you for just a second. So I think that getting proper treatment, the physiotherapy, the psychotherapy, all those things are going to be super important. And that's where our first priority should be. But I actually think that there may be bigger changes on the horizon too, further out. And this may take decades. But I think there's a possibility that we can actually eventually apply learnings from FND throughout the whole field of medicine. Now, this doesn't mean, for example, trying to treat a blood cancer with CBT or something like that. That's not at all what I'm saying. What I am saying is, remember how FND is basically the normal communication of the brain that has sort of gotten itself into a weird pattern because of its own normal rules that it follows. So to look at FND is to look at the normal behavior of the brain in a weird situation. And so if we can learn things from FND about how the brain works and the kind of like deeper underlying math of how these cells update and talk to each other, there actually is some possibility that other cells in the body have their own version of that kind of community dynamic. For example, that the immune cells, we know that they communicate with each other in different ways. We know that the immune system has a primitive form of learning and memory. Like when you get vaccinated, it learns the new antigen and remembers it when it encounters it in the future. That's how vaccination protection works. And there's indications that actually many different cell types in the body do sort of more basic versions of this. And so when we look at how we can apply FND to other areas of medicine, there are things like mind-body medicine that's using like meditative techniques and different attentional techniques that we learn in FND to deal with things like phantom limb or CIPN, which is a form of pain that happens in people who've gone through chemotherapy. And there may actually even be entirely new ways of healing, where we may be able to use some of these neural dynamics and the deeper math, calling on things like active inference and the free energy principle, to actually create devices that may be able to interface with other cells in the body. Now, this is super technical, so I'm not really going to go into it hardly at all. But basically, there's a sort of emerging field here called basal cognition that suggests that we may someday be able to interface with the cells of the body and tell them to do stuff using the same chemicals and neurotransmitters that they already use to talk to each other. And the sort of deeper math that we're learning from FND about cellular communication may contribute to that. So I think there's a pretty amazing opportunity here over like a 50, 100-year time span to actually completely transform medicine. And it would be pretty amazing if the sort of FND scientific and patient community is one of the places where that kind of really, that particular thinking got going. And so that's the end of the talk. Thank you again for being here. I really appreciate it. I appreciate you, lending your time and attention to this. And again, I'd say, I encourage you to think about your own experience and your story and what you've learned and consider what people might learn from you. Anything that you can bring to the table in regards to FND is going to be valuable and will be valued. And I hope that you'll consider how your gifts might improve the world. So if you'd like to learn more about the history of FND and a little bit about my story, I wrote an essay a few years ago called Cadenza for Fractured Consciousness. You can find the print version of that on Medium. And actually, there's an audio version by FND Action's very own Tom Plender, which you can find on YouTube. And I can be found at these social media handles. So thank you again so much. And thank you to the groups for putting this on. I'm going to stop sharing my screen so we can hand it back over, and I'm happy to go over to questions and chat.
Thank you so much. That was really informative. I think everybody would agree on that. It wasn't too techy and we all understood it. I just wondered, so has anybody got any questions for FND Portal or want to discuss a bit about like on our level of the community? If anybody's got any questions, I was just having a look through the chat. So one of the questions, FND Portal, is can you recommend a book or paper to learn more about the basal cognition? How's your library? Are you there, FND Portal? You're on mute. Oh.
So sorry, just had a little technical glitch there for a second. Yes, I actually can, I can recommend a paper. This is very, very technical. So I would say if you're comfortable reading scientific papers, this is a good one to check out, and I will put the link in the chat right now. But if this is a bit too much, and that would be totally understandable, what I would do is I'd recommend checking out a scientist named Michael Levin, like so. He's doing some pretty amazing work at Tufts University. And again, I want to emphasize, while I'm particularly excited about basal cognition, it will probably be a long time before this gets directly connected to FND. This is probably the kind of thing where it's going to like percolate in universities for like a decade or more before the connection really gets made. But I just wanted to take the opportunity today, instead of just focusing on the near term, to really like talk about the long-term dream, you know. So I don't want to set an expectation that you're going to benefit from basal cognition tomorrow, but just sort of give you an idea of the horizon that's further out.
Right, thanks for that. And we've got a hand up from Elaine's iPad, if you want to ask a question.
So my question is, why do you think many doctors dismiss it and just tell you that it's nothing?
Hey, Elaine. Yeah, that's a great question. I do think part of it is that stigma against perceived mental illness. I also think, to be honest, I think part of it is they're scared. I remember one time going to a neuromuscular clinic where they tested me, and this was like a super, like, you know, nationally renowned clinic that it took me like a year to get into it. And they just did test after test after test, and they found nothing. And when that was over, the doctor's confidence was like completely destroyed. And he was ticked off and he was mad at me. And I couldn't figure out why. And then I realized that FND really undermined his confidence in himself. And so I think sometimes doctors think it's nothing, or maybe they just don't think about it and they're just being dismissive. But I think other times they look at it and they can't make sense of it. And they've been through all this medical school and they like think they're really great. And FND really challenges that. And yeah, I think that's part of it.
Does that answer your question? Yeah. So I can't see. Oh, you're back on mute. So one of the questions we got as well in the chat is, I work in clinical trials and we struggle to get research through due to not enough researchers being interested in FND. Do you think this will change in the near future?
Sorry, this is somebody that actually works in clinical trials?
I'm not sure. I don't know. Is it Michelle? I don't know if you want to turn your mic off and maybe ask the question. I'm not sure. It's just written in the chat. Is Michelle here? No.
Hello,
Okay,
sorry.
so either.
Oh, hey,
hey, Michelle.
Hello, yes, I work in clinical trials.
I think, I mean, in many respects, I think you know a lot more about that than I would. You certainly have expertise in that area, and I don't. I think that in just at a general level, I do think that we're going to pick up steam as we go, because every time that we add new evidence, it becomes more and more unignorable, is my personal feeling. Maybe I'm just optimistic.
Yeah, I mean, obviously the ones that we have for us tend to be very, very regional, and regional as in very large major cities, you know, Birmingham, Nottingham, Newcastle, places, you know, and that obviously London, whereas I live in the very far southwest, and we don't even have anybody is a neurologist that specializes in FND. So we have literally nothing. The nearest for me is about 3.5 hours away.
Yeah.
You're saying that's in the southwest, Michelle? I don't know if you want to say something, Mandy, because you cover FND Friends.
Yeah. Hi, Michelle. What area? So FND Friends cover the whole of the southwest from Gloucestershire all the way down to Cornwall. We have some amazing neurologists in the southwest and some fantastic neuropsychologists. If you fancy PM me or email me on mandy@fndfriends.com. We've also got a closed Facebook group as well, so please join that and we can put you in contact with all those right people, signpost you to who you need to be signposted to.
Yeah, I mean, I am already a member anyway, so yeah.
Okay, is that okay? Thanks, Michelle, for that. I've got Claire with the hand up if she wants to, if you want to unmute and ask a question.
Yeah, hi. I just wanted to ask where you stand on FND being treated on the vagus nerve level.
Yeah, thank you, Claire. It's a really interesting question. You know, I think it's worth looking into. I don't know specifically how effective that particular treatment will be. Maybe there's no way to know in advance. But the vagus nerve is downstream of the brain systems that produce FND. So
Yeah.
I think like if you basically go up the vagus nerve and you look at what it connects to the parts of the brain where FND is generated. So yeah, I think it's quite possible. And I think it's also that different people might have different responses to it, you know. So I'm not quite sure how that would go, but I would support study of it for sure.
And also the sensory motor psychotherapy, like working with, I've experienced having that very briefly, and it was so much more effective because the emotional dysregulation and my delayed processing of normal sort of talking therapies actually made my FND worse. But when I started to have the sensory motor psychotherapy, it was all about talking, connecting with the body rather than the narrative. And that really
Sure.
started to help my symptoms.
It's great to hear it. Thank you.
That's great, Claire. I just want to bring this question up and see what you think about this, FND Portal, because someone's asking what would need to happen to remove FND from the DSM. And if anybody follows me on Twitter /X, they'll know I'm very anti-DSM. I'm very anti-dualism. How do we going to remove it? Because it doesn't need, well, I personally don't think it should be in there. I think the whole DSM is awful anyway, because we're all disordered. But what's your thoughts on it, FND Portal?
Yeah, thank
Public
you.
thoughts.
I think that question came from Susie, the legendary FND advocate in Canada.
Okay.
So really quickly, just to explain for folks who may not be familiar. So the DSM is the Diagnostic and Statistical Manual of basically mental disorders. So this is kind of like the Bible of psychiatry, basically. Like this is like where all the different disorders like schizophrenia and major depression and psychotic depression, et cetera, are basically cataloged and defined. So if you get diagnosed with a mental condition, it's supposed to be done based on the criteria that are in the DSM. So the DSM is a big deal because it literally defines like how mental illness is defined. Yeah, I'm gonna have to punt on this one. I'm sorry, because I truly don't know if FND should be in the DSM. I do strongly feel it should be in the ICD in a different form. And that has been a big mess. I think in the long run, the DSM might kind of go the way of the dodo. But I just want to be honest about the limits of my own knowledge. Like I could probably spend like 6 months to a year just reading about the DSM and like learn what's actually going on there before I offer an opinion on it, because that's just a little bit outside of what I've read about personally.
Yeah, I could probably spend 6 months discrediting it, but I think that's not the platform for that conversation. Yeah, thanks for that. We'll save that for another day. Esther, do you want to ask your question? Is it Esther? Sorry. Yeah, I think it is.
Sorry, Kim, before you go on, what is ICD?
So that's the international, what is it? FND Portal, International Classification for Disorders.
Yeah, it's
yeah, International Classification for coding, the coding of conditions.
Yeah, international. Yeah, I'm just looking it up now because I forgot the acronym. International Classification of Diseases. It's made by the World Health Organization, and that defines diseases like physically. Yeah.
So if you're diagnosed with something, they will look at that, and each condition will have coding next to it. So that's what they put down on their paperwork, sort of thing. FND at the moment is a bit of a mismatch because both FND and the DSM don't say FND, which is crazy. So the DSM says functional neurological symptom disorder, and the ICD says dissociative disorder. Is it FND Portal? Functional
Yeah.
so nobody else, they don't call it what we all call it as FND, and it's very like bit here, bit there, bit everywhere sort of thing. So say something like you'll have functional Parkinsonism under Parkinson's disease. It's all we're a bit mismatched. So I think, putting aside what I think about the DSM, I think the ICD definitely needs an overhaul as well for FND. But I think it's all about learning more about FND and how they diagnose it, and it will get better. So, sorry, Esther, what was your question?
Hi, I'm from Alberta, Canada, and I'm wondering if I phone the colleges of like LPNs and RNs and physicians even, where should I point them to for them to update their knowledge to help educate their members? Is it just the neurosymptoms.org website, or is there more available for these regulatory bodies to kind of jump on board to try to proactively educate its members?
You've got a charity now, isn't there? I don't know. I'm so sorry, I forgot the name. Is Tom still online, or FND Portal? What's the charity? Is it FND Together?
Yeah, there's FND Together.
It's a
Yeah,
charity.
for sure. They would be great folks to talk to. Hey, Esther, I think it's just going to depend on the specifics. And if you want to talk about this offline later, I'd be happy to do so. The short answer is FND Patient orgs are great. Neurosymptoms.org is great for like the short explanation. If they're looking for something a little bit more in depth on like actual medical practice, the FND Society is a really good reference for those folks to get to. And then also, if they're not looking to go quite that extensive, there are individual papers as well. Like there's a paper that's on FND for the general physician that I can send to you that gives like a kind of quick, like that's like a 20-minute read as opposed to like joining the FND Society and taking a permanent interest in that kind of thing.
Okay.
And if you have a look on the FND Action website, we started a campaign a couple of years ago, and we've got an information sheet on there with some useful links to research as well, which we're quite happy for people to use worldwide as well.
Okay.
Is that okay? Is that good? Yeah. Emma, I'm sorry if I'm not getting the right order, but Emma, do you want to ask?
Yeah, of course. Yeah, thank you. That's really, really interesting. Thank you so much. So one of the things that I just really wanted to raise and ask really was, I've been diagnosed for 2 years with FND, but I've actually had really significant improvements. And where I am today compared to where I was 2 years ago is just a completely different picture, you know? So for me, oh, hello. So no, so really for me, it's like when people do have, so what makes me really angry is that I've paid for my own treatments and I feel very privileged to have been able to do that. But for people who are underprivileged, I suppose, you know, and they're just left, I feel really bad for, because in my work, you know, in one of my worst states, of course, I couldn't walk. And I don't think if I didn't seek out the treatments that I've had, that I think I'd still be in that position now. And it makes me really angry that we've got people that are really, really disabled and are just not getting anywhere because the treatment isn't there. The services aren't there. It depends obviously where you live as well. There's massive waiting lists and everything else. But really getting to apart from what really bugs me, and that's that people don't get a fair shot at actually recovering in any way. But I suppose my question is, when we are seeing progress, when we do see this sort of like positive progress, how can we feed that in so that actually that gets into research to say that actually this does help, this has really helped with it? You just said something really powerful before when you were saying what's the difference now, and the difference now is us. So actually, how can we share what is, you know, what is positive around it, so that we can work to get in the right services in the right places, and the funding around the NHS possibly funding treatments for people, because as I say, you know, I know it's different for everybody, but you know, I'm really lucky to be where I am now from where I was. I'm really grateful for that. So yeah, really, you know, how can we feed that back in?
Yeah, thank you, Emma. I mean, firstly, it's so good to hearing that you're doing so well. That's amazing. Congratulations.
Thank you.
Yeah, I think it's going to depend on on you and your situation and the situation around you, you know? So for example, it could be something as simple as just telling your story to, in the most limited way, to a family member, or telling your story on social media, just to highlight that like FND exists and it can be treatable and some people can recover. So that would be like step one. If you wanted to sort of get further involved and like attest to the fact that these therapies really work for you, sometimes there are pathways into the healthcare system where you live. This is going to really depend on what specific hospital, you know, you're near and that kind of thing. It's not happening everywhere, but in some places they're actually starting to do things like patient advisory boards, where like if you're particularly interested, they will sometimes have spots where it's almost like volunteering on a committee or something, where you can show up and basically say like, hey, like let's update our website to describe FND treatment better, or like let's highlight these stories and that kind of thing. So I would say, you know, kind of like start local. And then also the FND groups that are on the call today are also tend to be quite knowledgeable about what's going on in the different regions where you live. So they might already have some information that you can talk with them about like, let's figure out like, what is the general situation in this part of the country where I'm living? And then what kind of opportunities might there be?
Lovely, thank you.
Yeah, I think the problem is it's a bit of a catch-22 because a lot of it is down to funding. And to get the funding, they've got to prove that the services work as well. But there is some clinical pathways. There's not a specific one for the UK, and there isn't any nice guidelines as yet, but some areas do have their own specific clinical pathways as well. But yeah, and it's talking about it, and like you say, we do need to do like I don't know if you know, but there's a trial coming out, results coming out shortly of a physiotherapy trial. So these sort of trials, we can then show that if there was neurophysio within a clinical pathway, it would help people. So I think it's just picking at it, and like you say, it's a postcode lottery, unfortunately. But if you want to, you know, if you want to get involved, or if you want any more information, you can contact one of the charities, and they like FND Portal said, they might have some pathways into finding out more information about it. Right, Susie, do you want to ask your question? We're just going to have a couple of minutes now, so I think just with Susie and Esther again, and then they'll be the last questions, if that's okay. But we'll do Susie first.
Hello, thank you.
Yeah, oh, I'm sorry. What's Susie?
Oh, is there a Susan? I've got Susie Skog, is it?
Yes.
Susie wants to talk. Do you both want to talk? No, Susie Skog, sorry.
Thank you. I was just wanting to ask, I recently had brain surgery for trigeminal neuralgia, and like maybe a week after the surgery, I started to stutter and pass out and have weakness. And I went to the hospital, and everything else, like I didn't have a stroke. And so based off of exclusion, the neurologist said that I had FND. But then I followed up with my neurologist afterwards, and he didn't seem to necessarily agree, but he didn't pay much attention to it either. He just said, oh, the psychology diagnosis, and he dismissed it. So I thought I read that there's supposed to be like a positive finding. And other than what I described with the stuttering and the weakness and passing out, and today for the first time, very, very painful lower extremity, like contractions that I couldn't relax. Other than that, I was wondering you guys' opinion. How do I find out for sure if this is a true diagnosis when I've got two neurologists giving me different opinions?
Yeah, thank you, Susie. That's a great question. And I'm sorry to hear that you're in this situation. This actually sounds a lot like, the symptoms are different, but it sounds a lot like what the early stage was for me as well. I had not the FND diagnosis at that time, but I had different neurologists telling me different stuff, and it was super frustrating. So I think one thing that's important to know is how neurologists do what they do. So basically they look at tests but they also do exams in the room. And based on what they're able to see from both of those things, they basically try to make an inference about what the most likely explanation is. So Susie, you're right that FND is supposed to be based on positive signs. When it comes to functional stutter, that's not an area that I'm particularly strong in, and just want to be honest, like I know less about that than I do about some other FND subtypes. The first thing I would say is that if it's a diagnosis of exclusion, I would take that with a grain of salt. Hold open that there might be other possibilities. If the other neurologist disagrees with it, it sounds like what could be helpful here is getting some clarity from the neurologist about why they think what they think. Sometimes they're not willing to talk about this, so it can be tricky. Sometimes they take an attitude of like, you know, I'm the doctor, just kind of do what I say. But for real, neurologists should be able to explain their reasoning. So for example, you have a list of symptoms. The neurologist should be able to explain what they think is producing those symptoms or why it fits FND or doesn't. So for example, you know, I don't know your particular case. This isn't really medical advice, but like the trigeminal nerve is associated with the face. And if you're having leg stuff going on, that sounds like it might be something different. Like that potentially could lend weight to an FND diagnosis, but the actual FND diagnoses, when made properly, should be done with positive signs. So I would say step one, my just suggestion person to person would be, if you're able to have a conversation with them and just ask them to sort of explain why they think what they think, like explain the meaning of the different symptoms you have, you know, and like what would produce that. And if you don't feel that you are getting answers that are good enough from that, this will really depend on your personal resources and everything. But if you're able to get to an FND specialist somewhere in the US, they can give you a diagnosis, FND, thumbs up, thumbs down, that, you know, you can have confidence in.
And where do I find an FND specialist?
I would suggest in the US, the way to go there would be to go to the FND Hope website, and they have a provider directory there that will give you an idea of how you can find people based on on the area.
Thank you very much.
Good luck.
Right, I think that's wrapped up now. Steve, do you want to take over as the host? And thank you so much, FND Portal. It's been great. It's really been great. And like as a reminder as well, it has been recorded, so it'll be available online. But I don't know if you want to finish off, Steve.
Thank you, everyone.
Just to say a big thank you as well to FND Portal. It's been a really interesting session. I'm sorry we can't get through more questions. We'll be here all day, I'm sure. If you are joining tonight with John Stone at 7 o'clock, please use the same link that we've had for the first two sessions. I know some people got a bit confused, I think, with the messages. So it's the same link for this one as tonight. But otherwise, thank you very much for attending. Thanks for listening. Thanks for all your questions. I hope you found it useful, and we hope to see you later on. Thank you very much.